So Marlies, I know Marlies, she's been working here for almost a year. She's a third-year trainee, so she's now almost done 3 years of training in endoscopy. I myself am a fellow, so I did almost 2 years of training in interventional endoscopy. So I haven't seen Marlies doing endoscopy. She's a great endoscopist. But Marlies, tell me a bit, what are you doing in polypectomy now? What kind of polyps do you resect at this moment?
I think at this moment it's depending on what patients we get and in what station we are here in endoscopy. If we are in narcosis, if we are in the front with the patients under sedation. But I think it's I'm comfortable with the little polyps, so below 10 millimeters. And I think now in the last few weeks or months, I often come in contact with also polyps that are a little bit bigger, like above the 10 and 15, around 15 millimeters, I think. And that's...
So a couple of months ago, you basically did most of the time cold snare, if you say under 10 millimeters, and now you're starting to do more the hot snare and the piecemeal EMR level until what, 20 millimeter polyps?
Yeah, I think up until 20 millimeter.
Okay. Do you have any idea how many you already did of those polyps yourself?
I think I did some last year in Aalst, and I did a few here. I maybe like between 5 and 10, I think. Not that many.
Okay, so now you're almost at the end of your training here. What is your goal in gastroenterology and endoscopy? What do you want to do, or where do you want to get with your endoscopy in your daily practice?
Yeah. Well, I think I want to be a good basic endoscopist who knows what she's doing and is comfortable with the basic endoscopy.
So I'm very privileged that I already know you a bit, so that will make it a bit easier for me today, I think. But are there special things you want or you expect from me? Because I think I will observe you a little bit. I will guide you through. We will select a polyp that is, I think, or hope there is a polyp in this patient that is a bit at your level, and I will observe you a little bit and guide you through it. But are there special things that you wanna ask me, or you tell me before we start the resection? I would take the needle, to be honest, to open this up a little bit.
Okay.
Maybe section out the fluid. Now you're waiting to always use your time.
Because it's starting a little bit too much right now.
Where's the defects?
You're gonna tell them to stop. So Lynn, if you can hear me, you've got another couple of minutes, and I'm just going to get David to come in and take over. So just think about start winding this up a bit, yeah?
Okay.
Yeah, no, it's blunt or with
yeah, I would do it blunt.
Okay. Yeah.
So what you see here, because we're not far from the valve, we have some adipose tissues and so that is okay. Looks fine. Now go from left to right or right to left, but in a systematic way, doesn't matter how, through the entire defect. This looks fine. There is no polyp in there. And then this is the part that I was a bit worried about. I don't know what that is. I think it's just some, and then probably or some bunched up mucosa from cold snare is also possible. So maybe try to put the blunt needle onto that white so we can expand it to be sure if it's just if there is definitely no polyp or some element that we need to take off. So not there, but more to the right.
Yeah, that's
somewhere,
something.
and yeah, there.
Okay, yeah, do my
Okay. Right. Okay. I'll try to check it maybe with the new focus. Let's see what that is. I don't think that is very clear what this is. It might be polyps, so we have to take that off
Yeah.
and check the rest. So it needs a biopsy forceps for that. Yes, probably some MM left. And that part just behind the adipose tissue. Yeah, okay. So I would biopsy that off and then go around the margins now to see if we're definitely sure that there is no residual on the margin.
So Lynn, we're going to end that now. What bit would you biopsy off? Just saying, the white bit in the middle.
Yeah, I'm not sure if that is because we know from that first snare position that it was maybe still some polyp there.
Okay, so I'm going
to.
Okay, so that's great. So I'm going to ask Lisa to put the scope down, and I'll give the scope to David, and then can you go together with her into the debrief room and think about your feedback and using the video to help with that video with the feedback. Is that okay?
Yeah, okay, thank you.
That's great. Okay. And what you mean by subtle is small movements with the left, right wheel and up and down wheels. You don't do that when you use your right hand. It's like unscrewing a jam jar. You don't do little movements with your right hand. You're not programmed as a human being to do that. You move little movements with your thumb of your left hand, and she's not capable of doing that at the moment. So technically, this was very challenging for her because she's at the limit of her colonoscopy skills before you get to the polypectomy. And what you need is the tip control to control the snare, and she hasn't got that. So in the feedback, at the end of the feedback, you've got to give her 2 or 3 hardcore things that she can actually work on. And probably one of the critical things for her technique is to enable her to control the tip better, is to get full control of the tip of the instrument with her left hand. That allows her right hand to move the snare back and forward. Okay?